any time that this is a career or profession and you are increasing your knowledge and becoming a better nurse, that's the ultimate goal.
Yeah, I think the journey is the win here. I mean, getting ready for the CEN and studying and reviewing and looking at stuff that you don't see in your emergency department every day. That's the real win of the CEN exam. And I think that's really where you get the benefit. I think that is the bigger thing than being able to put those 3 little letters at the end of your name.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Greetings, everyone, and welcome to the Art of Emergency Nursing. I wanted to let the audience know that if you're going to be in Austin in a couple weeks for the ENA conference, I'm going to be part of the Fill Your Cup meetup. It's on Sunday, September 29th. You can find all the details on my Facebook page. If you're going to be in Austin, I'd love for you to come out, and I'd love to meet you. I'm going to bring some podcast equipment and do a little bit of podcasting on the fly while we're there. So it's going to be a lot of fun. This has been the brainchild of Sarah Wells, the new thing nurse, and we know you guys love her. So it's going to be a lot of fun. I hope you can come out. For this week's episode, I have something a little bit different for you. One of the most common questions I get asked is, Kevin, how do I prepare for the CEN exam? So to help answer that question, I enlisted some help from my friend, Pam Bartley. You've probably heard of her. She has over 30 years of nursing experience. She's one of a handful of nurses that have all 5 BCEN certifications, and she's the chief nurse passologist at PDB Education. She's helped thousands of nurses prepare for certification exams, and she's the perfect person to help get you ready for your next certification exam. So enjoy this episode with my friend, Pam Bartley.
Hi, this is Pam Bartley. I've been a nurse since 1984, started initially in a surgical intensive care unit. My first exposure to taking certification exams was a CCRN. I took it back in 1987. I've only been a nurse for 3 years, and I learned the hard way. I failed the exam by 1 point, and of course, that kind of stemmed me on to go back and then ace it the second time. So that was kind of my first exposure to exams. I took the CEN back in 1991, so it's been a long time since I've had my CEN certification also. What else can I tell you about myself?
So the
Help me out, Kevin.
So the CCRM was your first exam, and you missed it by 1?
First exam.
Oh.
1 point. And this was back in the days when it was pencil and paper. You could request to have it rescored, so I did, and they let me know that some of the ones that rescored it even said that I failed by 2 points. So I was like, well, never mind. I'll take the 1 point fail off of it. So
you're like, we'll just go with 1 right now. So
yeah.
Holy cow.
But I learned my lesson then that you actually have to study for exams, and it really kind of made an impact in me and where I wanted to go with my career.
So how long have you been teaching exams, Pam?
Let's see. I took the CEN in 1991. I think my first review course was one through our South Carolina ENA in 1992. Definitely taught it a lot different than I do now. And I've taught close to 200 courses, probably, just for CEN. I've been teaching CCRN since about that same time also, and then added CPN and TCRN after I received those certifications too.
Of all those classes, which is your favorite to teach?
Probably TCRN. You've just got the trauma part of it. So it's easier to teach, just the trauma portion. CEN is difficult. It's probably, for me, it's the most difficult of the certification exams for the review course to teach. There's just so much information.
It's so broad. I mean, and there's so much information for each of the systems that you're like, holy cow, how do you remember all this stuff?
Yeah. When you look at the exam blueprint outline from BCEN, the CEN is 6 pages. TCRN is a page and a half.
Wow.
So it's for teaching the review course, it is definitely an easier course to teach.
Now, when you teach your review courses, do you teach them in 1-day format or 2-day format or both?
I try not to teach a 1-day CEN review course. Every once in a while, a facility will talk me into it, but CEN, again, 6 pages of in-depth content to where you go from life to life, death. I mean, you just can't cover all of that in a 1 day. And when I go back and ask people how they did on the exam, the pass rate after the review course is not as high in a 1-day review course, I found, than in a 2-day.
Yeah.
TCRN, since it's a 1.5-page blueprint outline, is easily taught in an 8-hour review course. CPEN, to me, in the past, has been easy to do in a 1 day. It's a lot of content that's been added to the CPN with the 5th edition and PC. So now I will do either a 1 or a 2-day.
So when you do your TCRN review, that's a 1-day review typically?
Yes.
Okay.
Because when you really think about the nurses who take the TCRN exam, the vast majority of them have taken TNCC, ATCN, TCAR, or have that trauma background. So they've got the basics. You're just kind of building upon that.
Yeah, a lot of the first time I taught a TCRN review, it was mostly ICU nurses. It was probably, 60-40, but it was definitely the more nurses were ICU nurses, and it had been long time ICU nurses.
Yeah, and typically they do better than the ER nurses if they've taken TNCC. If you get an ICU nurse that may be in a rural facility that hasn't had TNCC, then they do not do as well.
Yeah. But
typically the ICU nurses do better.
For the TCRN, how critical is it to take TNCC first?
Crucial. I beg anybody who comes to my TCRN review courses to have taken the most up-to-date TNCC class. So starting August 1st, they'll all be 8th edition, and I try to encourage everyone to try to take an 8th edition TNCC course before taking TCRN. And I put all of the information from the newer courses in there. The same for our CPEN. I really encourage anyone who's taken the CPEN to take the 5th edition ENPC course. It's a lot of material that was added from that 4th edition. And you can see it's been a drastic change in the pass rate on the CPEN since that new 5th edition came out.
Is it going up?
The CPN, the pass,
or going down?
It's gone down.
Wow.
Yeah, it was 75%. The pass rate is now 63%.
Holy cow.
Just from that new content. Yeah, got a lot of new content that got added in there. But we are seeing a lot more people take the CPN exam.
So that probably helps kind of change the pass rate a little bit too.
Yeah, just a little bit.
Yeah. And what about the pass rate for the CEN? What's the pass rate for the CEN?
The pass rate for the CEN over the past few years has been 62, 63, 60, but with 2018 it was 57%.
Wow, that's low.
So, but that's getting a little bit low there. There was 9,000 people taking the exam in 2018, which is more than what we've typically been seeing. Tends to run a trend of about 7,000. So the fact that it was 9,000 may have a little bit to do with that also.
Yeah. Yeah, I mean, increased numbers is definitely going to increase both the pass and the fail rate.
Yes.
So I wanted to have you on the podcast because many of my listeners are looking at doing their CEN, TCRN, doing a certification review exam. We're mostly going to be focusing on the BCEN certifications, TCRN, CPEN, CEN, as well as flight and transport. We'll kind of touch on because you're certified in those as well, right?
Yes.
So we'll kind of touch on those. I think getting ready for any of those exams, whichever exam you choose to take, is probably going to be pretty close to the same. So
yes.
If I am getting ready to take an exam, I decide that I've been a nurse for, I don't know, let's say I've been a nurse for 6 months or 2 years. Does it matter how long I've been a nurse when I take the test?
It depends on your test-taking ability and your knowledge. And it doesn't mean just because you were a 4.0 student in school that you're going to automatically pass this. But it really does. Test taking ability is part of it. Sometimes that newer nurse has better skills as far as test taking. The knowledge component, though, is crucial. If it's that new grad who has very little nursing experience, then they may want to wait and get a little more experience under their belt. If this is that new graduate nurse who has worked in the ER while they've been in school, or they have a background in EMS, has some other preparation for the exam, they may be able to take that exam and do very well on the earlier out. So I don't always tell people to wait for that 2 year. If they feel like they're prepared earlier than that, and if they will make a plan to study the correct information, they can do that before that 2 year mark.
Now you mentioned the studying the correct material. How do you find out what material is good and what's, are all CEN books created equal?
No. If you order a book online and there's no author's name anywhere when you are looking at purchasing that material, that to me would be a red flag that it's probably not an appropriate study material for that exam. Look for things that have been registered with BCEN, so it will have the little R trademark on there. And also look for, just reputable material. Find out from other sources if this is something that coworkers use and that they found to be successful. And look on the BCEN website. So www.bcen.org will give you that exam blueprint outline. It will give you test anxiety tips. It'll give you some information about learning style, and you need to train or to study based on your learning style.
Okay. What are the different learning styles?
When you're looking at learning styles, some people are very good with self-study, and they can take information from a packet, they can review it, comprehend that information, and turn around and do very well on the exam. Some people need to be in a live class. They really need that auditory and that visual stimulation. They need to take notes, and that's the way they learn best. Some people like to watch videos. Some people like online learning. Some people like to just practice questions. Some people like to use applications. So it's really what works best for that person.
Okay. When you've chosen your material and you've decided to pick a date for your test, how far out should we, when you're getting ready to start studying, how far out do you typically tell people to plan ahead to get ready to take the exam?
I always tell people it's like preparing for a marathon. If you think that you're going to decide on Monday that you're going to run in a marathon on Saturday, then you're not going to have a high success rate. Based on your knowledge and your test-taking ability, start studying. I tell people to start with 150 sample questions. Take the complete 150 sample questions, grade it. If you can score 75% or better, then that gives you a guide. And then still look at the areas that you are weakest on, study those areas, and go for the exam. If you take a practice exam and make 50%, 60%, still break it down into which areas are your weak areas and plan to study those areas. Most people still need about 3 months to study for this. So when you register, you get 90 days to take the exam. Register makes that commitment that you're going to do
Absolutely.
it, and then make a commitment to that 90 days that you're really going to study.
Absolutely. I think that's one of the things that was kind of drove me more than anything else is I put my money down. And said, okay, I'm taking the exam. I got my window, and then I signed up for a date right away. And then there's that date on the calendar, and it's looming, and you either get ready for it or you plan on not.
Absolutely. And a lot of people, if you choose to do a live review course, then I tell people to register for the exam, practice and study material even before you come to that review course, and then plan to take the exam within the next few weeks after the review course while everything is fresh on your mind.
Absolutely. I think that's a great strategy. I've given that same suggestion to folks many times where I say, study, then take the review, which again should be review. It shouldn't, there shouldn't be a whole lot of new material there. There's going to be some, Depending on your area of practice, there's certainly going to be some things that you don't see or you don't do. But if you're studying, then most of that should be a review. And if it is, and you're good, then get that exam done right away.
Yeah, I think the review course is more to help you refresh that information in your mind, to help you focus on those important concepts, to remind you of some of the phrasing, the treatment has been effective if, people have problems with some of those evaluation questions, and we can help them focus back on those. We can help them with some visual and memory aids and mnemonics and things that can help them in the review course, but we cannot teach them how to be an emergency nurse in a 2-day review course.
No, that's for sure. I always tell people that I'm not going to make you I'm not going to make you a better emergency nurse today. That should have already happened, and hopefully that's already happening. But it's, this course, most of it again should be review when you're taking a course.
Yes.
So, absolutely. So, 3 months. I'm going to take the exam. I'm going to take it 3 months from now. How do I start? You said start with the 150 practice questions. Is that available at the BCEN website, or is there a site for 150 practice questions?
There are several ways to get those. ENA has the CEN review manual that has I think 5 different practice sets of questions in there. So you could take the first one of the 150, gauge how you do on that first one, then make a plan of action based on that. Mark Boswell sells books that are $12 or $14 that have 150 questions in each set. BCEN sells their questions at 150, I want to say about $50, $75 on there, so you can get a gauge from that 150 questions. If you're only studying by using an app, then you're just doing one question, looking at the answer.
Yeah.
One question, looking at the answer. Studying again, if you can do that 150 at a time, then you can really plan your time out. You have 3 hours to take 175 questions. And a lot of people have never sat for 2 to 3 hours just taking an exam before.
That's tough. It's not easy.
Yeah, and again, if they're newer nurses, they still think, I've had them at the end of a 2-day review course still ask me, are you sure it's not going to turn out at 75? So it is not going to turn off at 75.
This isn't the
You
NCLEX.
will sit there and answer 175
You're going to
questions.
get every single question.
Gruesome. Yeah, it's gruesome with that.
How big is their test bank? Because I know not everybody gets the same lot of questions.
I do not know. BCN would have that answer on exactly how many questions are in that test bank, but there is a high number. Again, and there's a lot of the test questions are written similarly, but if you take an example of a diagnosis of pericarditis, some of the questions in the bank are going to be about the assessment of that patient. What are those signs and symptoms? Something else is going to be about the analysis of the data that you found on your assessment. Some's going to be the treatment plan. Some's going to be the evaluation or the reassessment of how you know if the treatment plan has been effective. So from that one particular diagnosis in that bank of questions, there's probably 25 or more questions in that bank. So you're going to get something on pericarditis. It's on the exam blueprint outline. You just don't know what question you're going to get on it.
Absolutely. And it's, I like that you broke down the different types of questions that there are, because it's not all, from memory. I mean, one of the things that I found when I took the exam, and I took it not that long ago, and I found that, so much of it was processing. Are you able to process, what exactly has happened? You've started treatment. Has that treatment been effective, or how do you tell if that treatment's been effective? I think you mentioned that earlier. And certainly those type of processing questions were absolutely like hallmark on the test.
And it should be. I mean, these are critical thinking questions. You want this to be a high-functioning emergency nurse. You want someone who can triage that patient and pick up on subtle changes and recognize that. Not that you have to make a complete diagnosis. but you should be able to make a differential diagnosis and understand if this is something that is life-threatening or not. But 32 of the questions are assessment, 34 are analysis, 43 are intervention, and then 25 are the evaluation or reassessment. And I think people do forget about that reassessment part, as we do at work. It's not exactly our strong point at work either. So we have to think about that reassessment is key for this exam also.
Now, one of the questions I get asked all the time, is there PEDS content on the exam? On the CEN exam?
Absolutely, it's going to be. Yes, and there are going to be some PEDS questions because the exam is set up for a general emergency nurse. So for that general emergency nurse, you can plan on seeing 15, and depending on your area, 15 to 30% PEDS. And it's an area, again, that may be a weakness for a lot of emergency nurses. So for a review course and for that exam, they really do want to make sure you know this PEDS-specific information. And most emergency nurses have taken PALS and or EMPC, so it's similar content. I think some nurses just cringe a little more at the PEDS questions just because it's given a scenario of a child. But asthma is asthma. It does not matter if the patient is 6 or if that patient is 26. You're still going to treat it the same.
I think that's one of the things I found when I took the exam most recently is that there were some questions that were PEDS questions just because they happened to be a pediatric age. But in reality, what it was it was an airway question. In reality, it was a pathophysiology question. Just happened to be a pediatric patient. So I think people need to not get hung up on the age of the patient, but certainly the content of the questions.
Absolutely. And some will be exactly pediatric. It's going to have pyloric stenosis. Some of the infant GI kind of questions may be on there. So some may be specific for them for being a PEDS-specific question.
Yeah. What's the best way to read a test question?
It depends on the question. And the one that I usually try to prepare people for are the questions that end in incorrect, accept, not correct, or prioritization. If you get the ones that are the incorrect, accept ones, then I always tell people as soon as you see it, because it's always at the end of the sentence and it's bolded, then stop reading the question, read the 4 choices, and see which one stands out. If 3 of them are things that are tacky or something that's increased, and one says slows down, decreased, Brady, then that's the one that's going to be different. Then you can still go back, read the questions, see what they're asking, but you've already figured out the answer by just looking at the 4 choices, and it will really help you with those accept questions. The other ones are going to be the prioritization, and prioritization typically is going to go back to the ABCD, still our primary, secondary assessment that we learned in TNCC, EMPC. But we've changed some of that content based on ATLS to where, again, circulation can come before A in the circumstance of mass hemorrhage. So read the prioritization, really thinking about what those ABCDs are.
Okay. Now going back to the timeline. So I'm now about 2 months out from taking my CEN exam. I did a practice test. I identified my areas of weakness, and I've kind of looked at some of the concepts of. I always found that what I find is that there were concepts that I needed to review, and then there were factoids that I need to review. How do you distinguish that content where maybe there's a global process or more complete process that you need to know versus just those little factoids?
For the facts themselves, just get a good physiology book, and the ENA Sheehy's Manual of Emergency Care is always my favorite, that you can just go back and really get that good general emergency nursing knowledge in there. When you're really looking at how to take or what the critical thinking application process is where practice questions come in. The more practice questions you can take, the better prepared you are. So having a good book to have the knowledge, and then again, that's where those apps can come in handy. It's something that you can have in your hand, you can take to work, and you can just practice repeat questions just to get you into that test-taking mode.
Absolutely. I think that's one of the cool things about the apps is you can take, question after question, and sometimes depending on the app, you get what you pay for, I think. Some of the free apps maybe aren't as great as the others, but some of the free apps can at least get you in the habit of taking tests and reviewing test questions, and being critical of test questions to say, okay, was there a distractor word there, or is there a qualifier that made it all but or everything except? If you can identify those words, and they'll help you more successfully answer that question.
Absolutely. But still, completing a full set of 150 or to 175 questions at a time will really help you get that timing down. Knowing that you have that 3 hours, if you don't know if you're a faster test taker or a slower test taker, you really need to practice a full set. I had a nurse who sent me an email the other day that he had 50 questions to go and only 15 minutes left.
Oh my!
So he
no pressure there.
Unfortunately failed by a few points and was just devastated about it. But he did not practice the 150 questions like I had asked him to. Instead, he was only using an app. He said, I practiced a lot of sample questions, but it was only using an app where he was just practicing question after question. He had not done anything to prepare him for that 3-hour time frame. So you really have to have a lot of different study methods and then pick what's going to be most important for you.
Yeah. I think just getting in the habit of taking that exam, because 3 hours is a long time to sit for an exam.
It is.
If you're an ADD kid like me, and have a hard time sitting still that long, it makes it difficult.
It is. And remember, when you apply, if you do have a medical statement of attention deficit disorder or hyperactivity disorder, you can request additional time. I think it's only about 15 minutes, but you'll have to do that with your initial application with BCEN, and you will need that medical statement.
I had no idea that they did that. That's interesting to know. So,
see, now you can get more time.
More time. That's good.
And you can get the quiet room.
Yeah, I took an exam recently, and there was the general room where there was, probably 15 or 20 test-taking booths where everyone was in the booth and taking their test, and they provided headphones for sound if your exam included sound, or there were just headphones for just general quiet noise-controlling headphones, and those were, there and freely available for you to use. But I also noticed that there was a quiet room with just one single station. And I wonder if that was for people who get distracted.
That's it. So if you do go in with a medical statement, then you can get that quiet room, as I call it.
Yeah.
ER nurses tend to be fine with the noise. I think critical care nurses a lot of times will tend to use for their exams, you tend to see them with the headphones on. Emergency nurses are used to the noise. So it's not as big of a deal for most of your emergency nurses again.
Yeah, I think the quiet is the bigger problem for me. If they would have said, hey, Kevin, do you want to listen to your headphones and listen to some music? I would have been like, absolutely. That'd be a great way to take the exam. But, of course, they don't give you that option.
No.
So, nope, they don't give you that option. Okay. So now the time is looming. My date is near. I'm about a week out. What should I start focusing on?
Focus on those areas and just practice sample questions and just focus on your weaker areas. Cardiac tends to be a weaker area for some nurses. Obstetrics, everybody always feels like it's a lot of OB. It's really not that many questions, but everybody, it tends to be a weaker area for nurses, so focus on those. If the peds part is your weaker area, then study that. And also the professional issues. People tend to forget that there are non-clinical questions on the exam. So really go back and think about those professional issues. There are things that we do every day. We should know them, But you have to go back by evidence-based practice and really the way we should be doing things, which sometimes we have to be reminded of. There are also a lot of questions under that area that are on disaster management that if we haven't practiced it recently, it may be something that we've forgotten. So go back and don't forget about those professional issues.
What kind of topics are in that professional development or professional?
In the professional issues part is where you will get the disaster management. You'll get more questions again on research. If that's a weak area for you, then you may want to go back and look at research and evidence-based practice.
Okay.
End-of-life issues, forensic evidence collection. There's usually 1 or 2 questions that you'll see on there. Some professional issues parts on delegation, knowing HIPAA laws, EMTALA laws, risk management. Some of those things would be under those professional issues.
Okay, so it's kind of a catch-all. Everything else that didn't fit into one of the physical systems.
The non-clinical.
The non-clinical piece.
Yeah, that's it.
Now, does the TCRN and the CPEN have those professional issues as well?
They do, and you will see a lot of the same questions on those exams. TCRN tends to have a few more questions on their professional issues that will cover trauma centers and the different levels of trauma centers and the designation, the role of a trauma program manager, the role of trauma registry, injury prevention coordinators. So their professional issues questions will be a little different. CPEN or the CPEN will have more questions that will be specific for children. So may have a few more questions on maltreatment and stuff on the professional issues than you will see on the CEN.
Okay. Good to know. Okay, I'm down to a couple days. I got a couple days before I take my exam. Where should my last bit of focus be going on the, a couple nights before?
The big thing is to know where the test center is. If you have never been to this test center before, go find it a few days before. Know where it is, plan accordingly for your time that you're taking the exam. And if you are a morning person, hopefully you are registered for the 8 a.m. time slot. If you are not a morning person, do not register for an 8 a.m. time slot. Make sure that you're planning for more of the afternoon times. But know where the test center is a key thing. A lot of people get rushed that day of the exam, and they really don't know where the center is. And most of the time it's inside buildings, so you really do need to know where that is. So plan for that. Plan on getting some sleep. Don't start cramming. Don't order a new book the day before. I'll have people that truly will call me 2 days before and go, I want to order your study guide. It's too late at that point. You don't need something new to study at that point. You're just going to get yourself off focus and just get yourself more nervous if you pick up a new book then.
One of the things I found in studying for another exam that I recently took was that there were so many different resources out there that if I didn't stick with one resource where I said, okay, this is going to be my primary study guide, these other things might be able to, supplement a little bit. But I'm not going to reread 3 different books that are all covering ideally the same topic, because it ends up causing confusion. You're like, did I read that here or there? Not that it matters where you read it, but it sometimes there are things that conflicted a little bit, or one exam guide would really focus heavily on this, but this other one didn't. And part of that's probably based on the people who've taken its history with the exam, but I found that I had to kind of pick one study guide that was going to be my primary.
Yes, and I have people coming all the time. They'll say, I've already bought the ENA, CEN online material. I've already got Jeff Solheim's material. I've got Mark Boswell's material. I've got this. I've went through a course with MedEd. You've got to stop at some point. You don't need every book out there. We're all teaching the same information. We're all following the BCEN exam content outline. So it doesn't matter, as long as it is a reputable source. If you are purchasing a manual that has an author's name in it, you have got material that's, great quality. It's something that's registered with BCEN. then you don't need all of it. So again, don't overdo it.
Yeah. Night before the exam, I found the testing facility. I know where it is. Now I'm going to get there. I know when I need to get there. What do I do the night before? Am I still studying?
No, because if you go into the exam with your brain already exhausted, then you're going to be exhausted, and you don't want to pick up that extra shift. You don't want to work. I've had 2 participants in courses before that fell asleep in the exam center.
No, they didn't.
So they went at a
didn't.
time. It went to 2 of them that failed. They do not wake you up, just to let you know. And as we all know, nurses can sleep sitting up, so nobody had a clue they were asleep.
Oh my!
And one of them had to pass the exam before the end of the year. Had waited until December 15th, I believe, to take the exam. Fell asleep. Called BCEN and asked that they could take an earlier time, and you could tell they allowed them to bypass the 90-day window for retesting because you could tell they only completed 50 questions.
Yeah.
And then that was it.
Wow.
And did very well on the 50 questions they had taken, but fell asleep and then had to complete it again for that. And it just worked all night, and taken a shift and worked all night, and thought that would be the better idea to go in. So please sleep before you go. Please eat some protein. It is not a good time for a high fiber diet. You can take a bathroom break, but the time keeps ticking on that 180 minutes on there. So you really do not want to go to the bathroom and take too long in there. I'm not going to say if you're on a diuretic you shouldn't take it, but you need to plan and know if you're a fast enough test taker where you're going to have time to be able to go in and out. And they will rescan your palm as you go out of the room and back in the room. So even a short bathroom break is going to take a little bit of time. Gotcha.
Any other test day advice for participants?
I tell people to, if you wear glasses, take an extra set of glasses with you. Some of the testing centers and the ones that work there will not let you take the extra set in the pair in with you. But then if they get cloudy, get smeared, you end up breaking them, it'll at least be in the locker there. And then when you go to your testing center, don't take anything in with you. Everything is going to need to be put in a locker if you do take your phone, any of that. Don't wear a lot of excessive jewelry. They're just going to make you take it off. No bulky jackets. So plan accordingly to be comfortable, but without a lot of excess, because they're just going to make you take everything off.
Yeah.
Well, maybe not everything off.
Testing naked would be awkward.
That's right. That might be different. I don't know. That may be more fun. And have 2 forms of identification that have your name on it the way you registered for the exam. So you have to decide what name you're going to be when you register for the exam, and that you have 2 valid forms of identification. Your name is the same way.
Okay. All right.
That seems to be difficult for people. I have that question a lot. I don't have any identification that has my name on it this way. So please figure out who you're going to be when you register for the exam.
So if I take the exam, I go through, I take the exam, and I don't pass, what happens then?
Then you'll get a nice little email from BCEN, and it will let you know about your 90-day. You can take the exam again after 90 days. It is at a reduced rate, but they do want you to use that 90 days to actually go back and study. So you do not know which of the 25 questions, because of the 175, only 150 of them are actually used for the score. You do not know which of the 25 were not graded, but you do get a breakdown. So, for your 20 cardiovascular, you got 16 out of the 20. For your 16 respiratory ones, you got 8 out of that 16. So you will at least see what area you need to study and go back and study that material. Use that 90 days effectively.
Now, do you get your score right away, or do you get your results right away?
You get it right away. And you can usually tell when you're going out of the testing center and they're sitting there waiting to hand you your paper. A lot of the testing center personnel that work there are very excited to give you your good pass results on there. And some of them will have a separate little room to pull you into to give you your results if you do not pass.
Yeah. When I took the CPEN exam, when I took the CPAN exam. I walked out of that exam going, I'm not sure what just happened. It was, I felt prepared for it. I felt like I was ready for it, but I remember going through the exam going, the questions didn't seem anything like what I was expecting. And I walked out, and the guy has the results in his hand and goes, oh. And I'm like, oh, God. And he hands it to me and goes, congratulations, you passed. I was like, oh, you jerk.
Yeah,
Jerk.
Yeah, some of them are having fun, aren't they?
Yeah.
Some like to have a little bit of fun. So it just depends on who's working at your testing
My
center.
guess is most don't do that, but that was kind of funny. And I was like, oh, man. And the anxiety there when I took the CPAN exam, I took it and I didn't tell anyone I was going to take the exam. I just signed up for the exam and got my day, and then showed up one day, went to work and said, okay, I got to go. I'm taking a test. Or I said, I got to go. I have an appointment. Left work that day. I had to go that morning. Left work that day. Took the afternoon off, relaxed a little bit, and then went and took the exam. And sure enough, I came back the next day and gave my boss the little sheet of paper that says, look, I'm a CPAN now.
Wonderful, wonderful.
Yeah, I think telling everybody you're taking the exam certainly adds a little bit of pressure, and if you do your best job under pressure, maybe that's helpful. But if you're the type that I would never want to. I was the type of person I would never tell people when I'm taking the test. I would just say, here you go, it's done. It
adds pressure. And the other thing people will do is all the coworkers will go. They'll pick the same time and go to the testing center together. And you talk about pressure. If you're sitting here looking at another person beside you, it's too much. And some people have been excused from the exam centers because they've taken breaks at the same time, not intentionally. They just have, and then they may go, "Oh my gosh, did you get that question about a fractured penis?" And they start giggling, and they will ask both of them to leave because that can be seen as cheating.
Yeah.
So sometimes you just don't think about what you're saying, and instead of just kind of the humor and as typical ER nurses do, can be looked at as cheating. So don't go with your coworkers. Don't tell anybody when you're going.
No, that's good advice. That's certainly what I would do. I haven't even told you this yet. I recently took and passed the nurse executive exam. And
oh, how wonderful.
And I've been threatening to take that exam for I don't know how long. I've been
just a few years.
Just a few years I've been threatening to take that exam. And finally took it and signed up for the test. And the only one who knew that I was taking the test that day was my wife. And I haven't told anybody. I didn't tell anybody until I passed the test, and I was like, okay, I'll start telling people now. So.
Yeah, that's great. That's great. Congratulations. I'm glad you finally did that. That's wonderful.
It was one of those on my bucket list of things to do, and it just hasn't come around to doing it yet. So. The next on my radar is a CPAN. I got to get my CPAN back. I had the CPAN. I let it lapse. That'll be the next one on my radar to get.
Yeah, take that 5th edition EMPC. It truly does make a huge difference.
Yeah,
It's just been a lot of content added in that 5th edition that's on there. So take that and then go take the exam soon after.
Yeah, I will. I'll take that first. I'm going to take that, I believe, in August. I'm going to take the updated TNCC and the updated EMPC, both. So
good.
So. What else do we need to tell people about the test, Pam?
Well, let's talk a little bit about when you're sitting down in that chair, getting ready to take this exam, when they sit you right down and it starts with question number 1. You really want to approach that exam with confidence. They'll give you a little dry erase board or maybe old school kind of paper and pencil. And I always tell people, write your name with CEN, TCRN, CPM, whatever the exam is. Just write your name down with those initials after your name.
I love that tip.
And if you do get a little upset, you just look back over there at that and just keep seeing it. The other tip that I tell people to do to write on that little board is to think of someone that you work with that already has those initials after their name, that you may or may not feel they are the best nurse that you work with. And then you can just look back over there at their name and CEN after that, and then go, if they can pass this, I can pass this. Now, do not tell anybody whose name that is that you wrote on that dry erase board. Remember, it will be erased, or you'll throw that piece of paper away. But I think that's kind of a way to just kind of make you calm down. Don't go crazy trying to write down a lot of stuff on a little dry erase board. But if you do have a weakness, maybe blood gases, EKG lead correlation to what area of the heart has been where you have your STEMI, those things are easy little prompts that you can write on there.
Yeah, you can just
write down a couple of those things.
Kind of go in and do a little brain dump.
Yeah, just put a few things down. People will sit there and they'll waste 20 minutes trying to write everything on the dry erase board, and you have to remember you've got a minute per question, so you really don't want to take a lot of time. But for those, whatever your weakness is, that is a great place to put that on there. The other thing is to actually read the question, and especially if it's some of the longer scenarios. Some are very short, some have a little bit longer scenarios. Go back and ask yourself, what is the question really asking? Go back and really see what the question is. There may be a lot of extraneous information in there that may not be needed for exactly what they're asking from those. Looking for those keywords like the priority, and knock out those incorrect answers, just like on Who Wants to Be a Millionaire. Knock out those ones that you know are incorrect, but really think through the two that are similar and think about which is the best of those choices to pick.
I think one of the things I did when I was taking the test is I wrote little A, B, C, D, and then I had little hashtags like, okay, it's not A, it's not B, and I could just with a pen mark out and say, okay, it's not A, it's not B. Okay, so we now it's either C or D. And typically if you can get it down to 2, you can usually get it down to 1.
Yeah. So think through things like that. Look for those key words. Don't read into the question. Don't say, well, if an amylase was in here, then it would probably be pancreatitis. If they were going to give you a question about pancreatitis, they would have had the amylase and lipase level in the scenario. So don't read into the question. It's good to have knowledge and experience, but sometimes you start going, well, this happened to Mrs. Smith and Mr. Jones, and you don't want to read into those kind of things too. Some of the questions are just very straightforward. I think that messes up a lot of people. Some of them are kind of memorization questions, and I think it's just that people are looking for it. Well, that was too easy. So some of them are going to be easier. Some of them are going to be more complex as critical thinking questions. So don't be upset if something seems a little straightforward. So it's okay.
Yeah, I think that's one of the things that kind of threw me off is really simple questions. And you're like, seriously, that's it? You're like, is that all the question? I know that one.
And sometimes people will just get distracted by unfamiliar words in there, like poikilothermy and some of those. The rest of the scenario, if there happens to be a word in there that you don't know, look at the rest of the scenario and don't get caught up on some word. I had one that was an allergic reaction one time, and it said Hymenoptera, and I was like, what the Hymenoptera? And, now it's just a bee sting again, but I was so caught up in looking at that word, I really wasn't paying attention to the question. Was still an allergic reaction question. I needed the epinephrine IM. It didn't matter what the problem was. So don't get caught up with some of those words that are in there also.
Yeah, the words can probably be distracting.
I think another thing that gets us sometimes is our experience. We go, well, this is what we do at work, and you really want to let evidence-based practice guide your choice that you pick. A good example of that is K-oxalate. We know that still in our practice, we may see K-oxalate being given for hyperkalemia, but we know by evidence-based practice that it is not the best treatment plan for a patient, that the insulin really works a lot better, and that we need to stabilize, again, the heart with the calcium. So always make sure you're picking the answer that is based on evidence-based practice, not what Dr. Jones orders. Make sure that you really go back and study and have an understanding of those things.
Really kind of thinking through it and realizing that, just because this is how you do it at work doesn't necessarily mean that's the right way to do it.
we'd love it if things were up to date. Just not everybody's quite as up to date with all of our clinical decision making. So really go with what evidence-based practice says. If you read the question and the 4 choices and you go, none of this makes any sense, take a deep breath and then reread the question and the 4 choices again. A lot of times it's, even though the words like accept or bolded and underlined or, the end of the thing, you miss words. So go back and read things again. And don't change answers unless you really have misinterpreted the question. You can mark ones that you're unsure of as you go through. I always tell people to still pick an answer. You can mark it if you want to, if you have time at the end to go back, but always pick the best answer, the best choice that you feel is the answer, and then mark it. Don't leave it unanswered, because you are graded on how many you get correct.
Yeah.
And if I really have no clue, I pick C, and it's not, again, because C is the right one, but my compadre, Gina Carbino, is the only one that's made a perfect score on one of these exams, the CPN exam. So she picks C. So I pick C for Carbino if I don't know. It seems to have worked for her, so I'm going with that one. She was just smart and really knew it, but I'm still going with the C kind of thing for that. So.
Yeah.
Always pick an answer and don't change things unless you really misinterpreted it. If you've already done 175 questions, your brain is mush. You'll go back and talk yourself into changing it to all sorts of answers at that point.
Yeah, that's true. It's easy to do. It's easy to go back and say, oh, but what if this and what if that? And you're like, just go with your gut. Go with your gut. Go with your initial thought.
And you're exhausted. Yeah, you're exhausted. And we've all done it on an ACLS exam, on a TNCC exam. We've all changed something, and that's the thing that we got wrong. So it's time that we grow up and realize that changing answers is most of the time not the right thing to do. If you've misinterpreted the question and you look back at it and go, oh, that's what it was asking, those are times that you can change it. Otherwise, it's just like frozen. Let it go. Let it go. This is not the exam to try to make 100% on. It's just we need that pass score. So let some of those questions, pick the best educated guess you can. And again, you only need around that 70 percentile. So don't worry about having to get a perfect score on those things.
Yeah, for sure. Now you mentioned ACLS and BLS. Is that content part of the exam?
ACLS is. There will be some of the same questions. And again, for cardiac, it makes questions that you may see some of those pediatric questions in there. So some of your PALS questions, asking a defibrillation question for an adult is going to be specific for your defibrillator and the brand that you have. For a child, though, it's always going to be that first initial defibrillation, that 2 to 4 joules per kg. So it tends to give a place to put more of that pediatric content under cardiac to make sure to get enough PEDS kind of questions in. Otherwise, there's not that many cardiac things that are under the CEN blueprint exam.
Yeah. That's good. That's good. Good advice. Anything else we need to talk about?
I always tell people to create mnemonics that mean something to them. We all in nursing school were probably taught about on old Olympus towering top, and nobody ever remembered it. So make something that means something to you. I think many of us learned the OOO, to touch and feel, sticks with us a little bit better. Yeah. So if you can make something that, those are great ways. Have some memory aids. There's nothing wrong with that. It's not cheating. Just make a way that'll make it a little bit easier for you. But make things that are applicable to you. Some people learn better by flashcards with learning. I've had people that will take my key points and just read them out and put it in their words and will tape themselves saying it. And then they keep listening to it in their own voice. And that really sticks with them. So really find a study way that works for you. You have a friend that's a nurse and a truck driver. His family has a truck driving business, so he will do some truck driving. So he takes the content and will just put it in his own voice, in his own words, and then listen to it when he's driving. So, all nurses have at least 2 jobs, right? So, kind of make it work for you.
It seems to be the case, doesn't it? Yeah, that's actually
Yes.
a great idea. I'd suggest that someone else as well is go through the blueprint and just kind of talk your way through everything you know about each of the things in the blueprint, and that and kind of going through key points would be a great way. Because I think a lot of times if you can say it, then you're like, okay, do I really know that? Or you'll find out
Yes.
what part of that you know or you don't know.
Yes. And don't get caught up on the treatment has been effective if you know the signs and symptoms, then you picked an appropriate treatment plan, then the signs and symptoms they had should have resolved. So people say, well, I knew the signs and symptoms, but I didn't know how to know if the treatment plan was effective.
Yeah.
So don't make things more complicated. It's still the same content. You just have to put it in a different way. So if it's an extrapyramidal reaction, if you see a decrease in those muscle spasms, and the muscle spasms were that extrapyramidal reaction they were having to the medication anyway. If you see cirrhosis, where the patient's got encephalopathy and you have a decreased level of consciousness, well, after we did our treatment plan of our wonderful other favorite lactulose, then we'll see an increase in that level of consciousness. So it's still going to be based back on the signs and symptoms, but I think it's just hard for people sometimes to turn their head around and think about it in a little different way.
Yeah. I think sometimes we get so caught up. And one of the hard parts is being an experienced nurse is reading into the question, like going, oh, now if they had this, then they would have this, this, and this. And you're like, no, that's not in the question. It's not part of what we're asking. Stick with what's on the stick with what's on the screen.
Yeah, and I do. It's harder sometimes that you'll see that fail rate starts to, you'll see a high fail rate there with the less experienced, but you also see that higher failure rate with the ones with a really high experience, because again, we just tend to read into the question, and nurses with a lot of experience sometimes do not study as much. There's still nurses that go, I have the experience, I don't need to study. And it's different. This is different than clinical practice. It does not mean that this doesn't mean anything. And people will say, well, it doesn't make any difference. The ones that have the certifications are not any better nurse. But it's not saying that you're a worse or a better nurse, but it does. The information that you learn studying for these exams definitely will impact the patient care that you give. I had a nurse the other day that had let me know, he said, I picked up Guillain-Barré in a patient, and I really didn't know the signs and symptoms until I studied this material. Then I picked this up. Well, that's a pass, whether they passed the exam or not, and they did, but whether they passed the exam or not, that impacts patient care, and that's really the ultimate goal. Anytime that this is a career, a profession, and you are increasing your knowledge and becoming a better nurse, that's the ultimate goal.
I think the journey is the win here. I mean, getting ready for the CEN and studying and reviewing and looking at stuff that you don't see in your emergency department every day, that's the real win of the CEN exam, and I think that's really where you get the benefit. But I think that is the bigger thing than being able to put those 3 little letters at the end of your name.
Absolutely. I'm going to steal that. The journey is the win. I'm stealing that, just to let you know.
But it's the absolute truth. I mean, you think about how many times you've heard people say, well, I studied and then I picked this up, or you learn something, you learn about something, you read about something, and then you're like, oh, we had that. Holy cow. You've seen it in clinical practice.
Absolutely. Let's see which one of us can post that on Facebook first. I will give you credit for that. I'm going to post it on here in a minute.
It'll probably be you. So.
Yeah, but I will give you credit for that one. No, that's great.
All right. Sounds good. So. Well, this has been good. Anything else you want to remind folks about with the exam?
Just ask your employers about the voucher program. It's a reduced cost again for the exam. People will say, the exam's too expensive. But ask your employer about going and buying the vouchers, even if they're going to reimburse you. Maybe you could buy it. Maybe they could buy them. Maybe it's cheaper for the facility if they buy them up front. So look on the BCEN website. Again, there's a ton of information Test anxiety is on there. Picking out your learning style. Information about purchasing those vouchers is on there. The other thing is, remember, you have to renew every 4 years, and you've got options in how you renew, but you're going to need to keep those contact hours up if you want to renew by contact hours. And don't wait to the last minute. When you renew, you will be attesting to your hours, but there is a higher percentage of people that are getting audited, and it's pretty quick. When you go in and you will renew, as soon as you renew, then all of a sudden you get a little email that says you have been chosen to be audited. So if you really don't have those 100 contact hours, you don't have that long to get it, and they're going to know that you really didn't have them. So you really do want to make sure you have those contact hours.
Yeah.
And if you are an ENA member, that's free contact hours right there. You got free options available. National conferences coming up. If you attend one of the national conferences, you can leave from that conference with 30 hours or more. So it's another great way to get those contact hours. But don't wait to the last minute. You may not want to take that test again. You may, but you may not want to take that exam again. A lot of people don't want.
No, I know you probably renew each year. You probably have plenty of CEs, but do you take the exam again just to stay fresh?
It depends. It depends on if someone else that is working for me is up for that, and then we kind of decide. Like recently, Gina Carbino has been taking her exams instead. So I actually renewed this last time by my contact hours, and of course I got audited as soon. I got the email back immediately. You have been selected to be audited for your contact hours. So it was just kind of amazing to me how quick that email came. So the one time that I go, oh, I'm not going to take the exam this time, I'm going to just renew since Sheena just took it, and that's the time that I get audited. So it just depends. It depends on how busy we are in life, and if someone else has recently taken it, then I really don't need to go back and take it constantly. So, but you do want to, have someone that you're taking a review course with, or you're getting study material from, that's someone who is really keeping up with what the most up-to-date material and has the knowledge of what's on the exam currently. You don't want to study older material, and you do want to make sure you have that up-to-date material.
Now, I would imagine your TCRN review is coming up for review here probably pretty quick. Am I right?
Well, I didn't take the.
Did you do the beta?
The initial. I didn't do the beta test. I was on a call with someone who was frantic about their exam, and I did not make the time frame for the beta. So mine was 2016, and when I try to keep all of mine on the same year for renewal because it makes it a little bit easier, except for CCRM, which is 3 years and not 4. So I did the trauma, transport, and flight all at the same time in that same month. So it'll be kind of nice. They'll all come up at the same time next year. So an expensive time when it's time for all the renewal and joining all the association fees and stuff, but it's well worth it. So.
Now, how much overlap is there between the CFRN and the CTRN, the transport nurse?
CTRN,
did I say that right?
A lot. If you look. Yes, you got for the certified flight registered nurse and the certified transport registered nurse. The exam blueprint is one blueprint. All it shows you is where there is specific content that is specific for the CFRN that will not be on the CTRN. And as you can imagine, it will be the flight physiology, the gas laws, and those things that would be different on the certified flight registered nurse versus the transport registered nurse.
And how much overlap is there between that content and the CEN? I would imagine the medicine's about the same.
I always when people ask me about the CTRN and the CFRN, it's a good combination of the CEN and the CCRN because you need some of that CEN content, but again, you're going to be transporting that very critical patient. So you're going to have questions on there about intra-aortic balloon pumps. You're going to have questions about actually titrating those medications that are pharmacology for hemodynamic support. So it's going to be a little deeper than CEN. So about 50% is kind of CEN information, and about 50% is CCRN information. So it's good information, a good mix of those two.
Okay. where can people find you online if they want to follow you online? And I know you do a lot of review questions and a lot of material on social media. Where can people follow you?
I have a Facebook page, LinkedIn page, Instagram page, Twitter page. All of that is under PDB, which is my initials, Pam Dominic Bartley, PDB, Nurse Education. I tend to keep the Facebook page. It's probably the one that I keep most up to date. And instead of doing sample questions, since so many other sites, there's a lot of free sites that have these free sample questions for you. The ENA, CN Online, there's free sample questions on there. Jeff Solheim with Solheim Enterprise with Emergency Nurse Central has free practice questions. Mark Boswell with Boswell Medical Education has the free sample questions. So what I give are kind of key points, tips of the day, a little bit different approach. It's just to have a different spin on it. We all kind of try to give something a little different. So tips of the day is usually what I tend to post on there. So you can follow me on there. You can also, again, find my webpage, which is the PDB Nurse Education, or you can email me at any time. I respond pretty well to messages or with email at pbartleysc@gmail.com.
Well, this has been great, Pam. I think this information will hopefully be real helpful for our listeners who are looking to take the certification exams. So I appreciate you spending the time talking to me and answering my questions.
Thank you so much. And the journey is the win.
The journey is the win.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.